when it comes for the PCOD, उसका कोई specific age है that this is the age it starts, या it can be any time of the life it can come up?
It can come up any time of the life, but usually it is seen around 20 in the adolescent age. That is around 20-22 के बाद में usually मिलता है PCOD. And when the real stress life starts because of the career and all, so and it might come after the after your marriage or after your first child, can come anytime.
Okay. So how we can control this, या can we get rid of it also अगर हम steps follow करें, ऐसा कुछ है, या it will remain only once it has started?
No, it goes. It is treatable. So it can be cured, but it can again come also if you don't live a healthy life. See, you should take good sleep. 7 to 8 hours sleep आपको जरूरी से लेना है. Number one. Number two, fast foods 100% avoid करना है. बहुत ज्यादा sugar और मतलब anything that puts on weight, that should be avoided. Whether it is fast food, whether it is sweets or chocolates or any such thing should be avoided. Plus stress level. आपको see, we also used to work. Our parents also used to work. Okay. During that time also they had stress, but they never disclosed their stress, or they never cribbed about it कि हमको बहुत stress है, हमको बहुत stress है. तो आजकल की generation कि हमारी ऑफिस है इतने घंटे हम कुछ नहीं कर पाते हैं, भाई नहीं कर पाते हैं तो you get up early.
Correct.
आप आधा घंटा जल्दी वो करो, या you try to speak to your boss. कुछ मतलब you have to do such little bit of adjustment or little bit moving out of your comfort zone. You have to do it. You can't say कि हमारा continuous sitting का job है इसलिए मेरे को PCOD हो गया या होना ही था.
Correct.
That is one of the factor, but you have to work on it. So who else is going to work for you?
Correct. Like it is always like कि कोई problem है उसका solution हमेशा रहता है. You have to figure out to fix it.
Correct. And see, liquor also. The girls have also started drinking.
Even smoking too.
Smoking too. So that also harms our body.
Correct.
Okay. And then plenty of chocolates we have. गर्ल्स आज की देखती हूँ मैं, चॉकलेट कोई डार्क चॉकलेट ये बहुत अच्छी होती है. चॉकलेट इज अ चॉकलेट, वेदर इट इज अ डार्क चॉकलेट और अ नॉर्मल चॉकलेट, it is rich in calories.
Even
so
to add on, they usually have a belief that dark chocolates are very good during the period time. That is also one of the concept in the head कि बड़ी अच्छी होती है तो ease down हो जाता है.
Correct. And then कॉफी का ट्रेंड भी इतना ज्यादा बढ़ गया है, ब्लैक कॉफी, फलानी कॉफी, I don't know what not, and then they think कि हम तो खाना खाते ही नहीं हैं. मेरा तो डाइट बहुत कम है मैडम, only 2 chapatis in a day or 1 chapati I don't feel like eating, because you are taking plenty of coffee. Coffee is it is a caffeine. So that keeps your brain stimulated.
Correct.
Okay. And you don't feel hungry if you have 1 cup of coffee or 1 cup of tea. You won't feel hungry for 2 to 3 hours. So you carry on with that, and then you complain कि भाई हमको तो भूख ही नहीं लगती है, हम तो खाना ही नहीं खाते हैं. But you don't see that you are taking that substance. So that is also bad, na? So balance should be there. I'm not denying that you should not take coffee, but not more than 2 cups. That too a smaller. What we are there? Everybody is taking such a big mugs of coffee.
वो मिलता भी वही नाम से कॉफी मग है ये.
हाँ, कॉफी मग. तो इतना कॉफी लेने की जरूरत नहीं है.
करेक्ट.
फिर आपकी नींद भी चली जाती है. कॉफी, इफ यू टेक कैफीन, आपकी यू डोंट स्लीप properly.
Very true.
So that is all interacted with it. But मतलब these girls, they don't understand. कि हम तो खाना नहीं खाते मैडम, ये तो फ्रेंड्स दे कम विद है कि इसको पीसीओडी है. They come with the diagnosis, इसको PCOD. What PCOD is there, they don't know. But ये खाना नहीं खाती है, and then फिर all the side effects they come. If you don't have your food properly, you will become anemic. You won't have immunity. You will succumb to small cold, cough every time. So ये सब होता है. Depression is also there. This is also one of the biggest factor. If you don't have proper food, you don't get proper sleep, and depression हो जाता है. So this is so common. एंड फिजिकल एक्टिविटी तो आपकी कुछ है नहीं.
करेक्ट
Normally physical, we used to go by cycle, correct?
करेक्ट.
You people, then you don't do cycling, you don't walk.
इट्स ऑल
So
गाड़ी लिया and पहुंच गए, या
पहुंच गए, तो आप एक्सरसाइज मत करो, बट आप साइकिलिंग करके आप आपके ऑफिस जाओ. That is
करेक्ट.
also a type of, when I used to study medical, I used to do 16 kilometers of cycling every day.
वाओ.
16 kilometers. And we never thought कि we are doing cycling or we are doing exercise. फिर हमारे लिए वही कन्विंस था, तो हम यहाँ से कोचिंग और मेडिकल कॉलेज हम उसी से जाते थे.
उसका भी टू ऐड ऑन, आजकल ये भी एक चीज हो गई है, द वे यू आर सेइंग कि ये चीज कर लो साइकिलिंग एंड ऑल, वो एक एक शर्म भी आ जाता है कि अरे यू आर अर्निंग सो मच एंड एक साइकिल यू आर ड्राइविंग इट, व्हाई कांट यू शुड हैव अ कार एंड कार को अफोर्ड करो. वो एक टू लुक, हम अपने
प्रेशर.
आप प्लेजर एंड टू लुक, या वी आर एट अनदर लेवल ऑफ, सबके लेवल
लेवल.
इक्वल लेवल्स में हैं. हम उस चक्कर में ये भी चीजें हम कट ऑफ कर रहे हैं, माइनस कर रहे हैं. मुझे बार बार आपसे बात करके अपने, आई एम काउंटिंग व्हाट करेक्ट थिंग्स आई एम डूइंग और व्हाट आई हैव एक्चुअली स्टॉप डूइंग इट. तो आई विल ऑफ कोर्स कीप दैट थिंग्स इन माइंड एंड आई विल इंश्योर कि मैं उसको कंटिन्यू करूं जो मैंने अभी फॉर फ्यू रीजंस आई हैव स्टॉप्ड. सो आई विल प्लान टू डू दैट. इसमें मेरे को ऑफ द ट्रैक जाने का बहुत मन कर रहा है. You said PCOD can come any point of time. One of the reason is sleep cycle and all. Currently,
Correct.
I'm actually a lactating mom also. So when I'm lactating my baby, ये ऐसा हो ही रहा है कि स्लीप साइकिल मोमेंट द चाइल्ड इज आउट, मेरा स्लीप साइकिल पूरा चेंज हो ही रहा है. एंड ऑफ कोर्स वो हर पेरेंट के साथ है, बिकॉज आई एम कमिंग अक्रॉस विद माय फ्रेंड्स ऑल्सो, तो जिनका भी है सबको वही प्रॉब्लम है. So even the lactating phase period, coming on and off, वो भी fluctuations हैं, प्लस स्लीपिंग साइकिल भी है. उसकी वजह से हमको खुद के लिए टाइम नहीं मिल पा रहा है, तो एक्सरसाइज भी मिस आउट हो रही है. So will certain situation of this also can lead to the PCOD phase, or it is just this is the lactating is completely a different thing?
This might lead to PCOD, but the menstrual cycles, they are usually disturbed when you are lactating.
Okay.
Because of the prolactin hormone, the cycles are not properly established. So that could be also one of the cause for not getting your periods regularly. Means lactating mothers, may periods, they are not regular. They could be regular, but sometimes they are not regular. तो कई बार 2-2 महीने में periods आते हैं. That doesn't mean that she has PCOD.
Okay.
That is because of the lactation. But PCOD का tension आप कब करेंगे? Once you stop lactating and if you don't get your periods, then you should get a sonography done and confirm whether you have got PCOD or not.
Okay.
And I would suggest that during lactation, don't think of reducing weight. Don't think much on that. You have your healthy food. अब जैसे पुराने जमाने में we used to have laddu and with lots of ghee and halwa, है ना? पहले मम्मी लोग बहुत देते थे. Now what we have found is कि we don't take that much of ghee or we don't take that halwa और laddu और इतना नहीं खाते हैं जितना ये लोग पहले खाया था. हम लोग प्रोटीन पे we focus much on protein. If you take plenty of protein, मतलब good quality rich class protein if you have, and fruits and all fruits and vegetables with a normal diet, that is also sufficient for your body. Previously हम लोग घी पे बहुत ज्यादा स्ट्रेस करते थे, फैट पे. अब घी नहीं पे स्ट्रेस करते हैं, and we go for a balanced diet even during lactation or after lactation. So and a bit of exercise you can always do during lactation also. अब थोड़ा बहुत जो भी है, वैसे भी आप if you are working for your baby, आपके exercise तो वैसे ही बहुत हो जाती है, but still you should find some time, at least half an hour in a day for yourself. So that will, because वो क्या होता है, mentally you get involved in that.
Correct.
Means exercise के जैसे हम मंदिर जाते हैं, तो हम नॉर्मली बोलते हैं दिन भर भगवान का नाम लो, हम भगवान का नाम लेते भी हैं, बट वो इफेक्ट नहीं आता है जो हमें मंदिर में जाके मिलता है. करेक्ट. मंदिर में हमारे सारे थॉट्स रुक जाते हैं, and we get that feeling कि हाँ बहुत कितना शांत लग रहा है, कितना अच्छा लग रहा है.
Correct, correct.
वैसे हम यदि हम 24 hours work कर रहे हैं with the baby or we are doing our household work, but still that won't reduce your weight for a half a kg also.
True.
If you do 45 minutes, means half an hour yoga or some exercise, cycling or walking, so that will be different.
Okay.
Inch loss तो होगा ही होगा आपका.
Okay, okay. So this is very effective point. अभी हम actually बहुत आगे हम बढ़ चुके हैं. We have to come back a little. The married life. अभी if moment we are planning to get pregnant and all, we are planning for the pregnancy. So when is the right time to approach to the doctor? Is it कि हम जब pregnancy plan कर रहे हैं, we have to meet to the gynac, or we can plan अपने हिसाब से भी, or we need to discuss and then take the call of the pregnancy, how it is?
See, I would suggest just before marriage, say suppose 10, 15 days, 20 days or 1 month before marriage, your parents should take you to a doctor. Understand what are problems or what consequences you are going to face medically. Just after marriage, being a girl, boys they don't have any problem, but girls may just say UTI is the most common after sex. UTI is most common. So what advices you should follow should be consulted with the doctor.
Correct.
Plus, if you really don't want children, if suppose if a girl doesn't want a child immediate after marriage, then she should know what are the what precautions she can take.
Correct, correct.
Her husband might use the precaution, he might not use the precaution. But if you are thinking that I don't want child for say 1 year or 2 years, then you should know what are the precautions.
Correct, correct.
A girl should know.
Correct.
Otherwise, what happens, within 2-3 months they get pregnant, and
Correct.
the couple then comes, madam, now we don't want.
Correct, correct.
Okay. See, if there is love marriage, then they can openly discuss. If it is arranged marriage, or if the girl is shy enough not to discuss such things before marriage to her husband, then just after marriage, she can talk freely with her. If she has knowledge, she can talk. If she doesn't have knowledge, then she has to depend on her husband.
Correct, correct.
So they should also be taught. Okay? And it all depends on the couple when they want to get conceived.
Correct.
After 1 year, after 2, there should be compatibility between the two.
Very true.
They should try to understand. ऐसा नहीं कि शादी हुई और बच्चा हुआ.
Correct.
क्योंकि प्रेशर तो रहता है इन-लॉज का, मदर का, अपने पेरेंट्स का, उनके पेरेंट्स का, बट यू शुड नॉट सकम टू द प्रेशर.
करेक्ट, करेक्ट.
आप हस्बैंड वाइफ के बीच में पहले एक दूसरे को समझो, साल भर यू एंजॉय योर लाइफ, घूमने फिरने जाओ, आप पूरा घर का एटमॉस्फेयर देखो, फाइनेंशियल स्टेटस देखो, देन यू कैन प्लान ऐसा. एंड ये तो पहले से ही सोच लेना चाहिए कि आपको कब चाहिए, मींस व्हेन यू वांट द बेबी, क्योंकि इट्स नॉट गुड टू कंसीव फर्स्ट एंड देन कम फॉर एन अबॉर्शन. इट्स करेक्ट. I won't suggest such type of things. तो अब इतना ज्यादा फास्ट जमाना आ गया है कि आप लोगों को भी पता है, तो you should discuss it out.
When it comes like say abortion wala piece, when they become pregnant, they say they don't want to conceive a baby. Is it good, when they abort, again a woman's body suffer or go through a lot if they plan later on also, or it is just for that phase, that's it, then the body will be all okay, how it is, and even does that impact the period cycle also?
It affects everything. It affects your body, it affects your uterus, it affects your mental status also. Your periods gets irregular. ऐसा नहीं है कि बहुत सारे, because the parity counts कि आप कितनी बार pregnant हुए हैं. The uterus also becomes weak. So you should take precaution.
And especially if the woman's body is already having PCOD, So pregnancy plan करने के पहले we should visit the gynac or
Yeah.
the patient
Because PCOD is in the girl who is having PCOD, in that girl, ovulation won't be there.
Okay.
Because it is an hormonal disturbance. So
Mhm.
the patient will, means that the girl will menstruate, but ovulation won't be there.
Correct.
So in that case, when the ovulation is not there, pregnancy becomes difficult, and it becomes difficult to have pregnancy. So we have to treat the PCOD first, and then go for pregnancy. She won't conceive.
Okay.
If it is only in one ovary, or it is very milder type, it has just begun, then she might conceive. But otherwise, she can't conceive because there is no ovulation.
Okay. So also people do say, I remember my pregnancy phase also, like, if you're planning it, the baby, then, you should stop the exercise and all. Is it true? Or you should start just focusing on the healthy meal. I personally believe कि healthy meal, when it comes for that, that should go from the beginning या पहले से ही. वो suddenly, if you want to enter a new life, a new phase of your life, suddenly उसको start करना मुझे personally ठीक नहीं लगा. But exercise, do we need to stop, or we can still
No, we
continue?
don't have to stop. No, not at all. If you are planning pregnancy, you can continue with that exercises. Whatever exercise you are doing, you can continue, because like in menses, like in our periods, we don't stop doing exercise unless there is pain or heavy bleeding. Then only we
Correct.
stop. Otherwise, if we are continuing, it is a normal physiological phenomena of the body. So pregnancy also, it is not a disease. So you can continue pre-pregnancy. You can continue with all the exercises you want. Once you become pregnant, for the first 3 months or for the whole pregnancy period, you can do yoga and all, but not weightlifting or heavy exercises or abdominal exercises, especially abdominal exercises which are heavy.
Correct.
Means weightlifting or very vigorous type of exercises you should avoid. Otherwise, you can continue with, like we suggest, walking. 45 minutes walk आप करो ना. Pregnancy में भी walking is the best exercise.
Okay.
Deep breathing exercises, many yogasan जो रहते हैं वो भी it helps. So you should do. You should not quit exercises.
Also, you mentioned in one of our discussions about the RH factor.
Yeah.
So during the pregnancy, the ones who are holding that have to take more precautions, or the journey will be smooth enough for them also, and they have to be, or rather they have to be worried कि जब बच्चा होगा उसको भी RH factor वाला होगा नहीं होगा. That is also the concern which people have it कि मेरा RH है तो मेरे बच्चे का भी होगा. So how true it is?
RH factor need not to worry about it. But the only thing is, when husband and wife's blood group RH factor doesn't match, if one is positive, especially the girl is negative and the boy is positive, then the baby might be positive or might be negative. Okay.
Correct.
The problem. So immediately after delivery, the doctor will get the blood group of the baby done within 24 hours. It is immediately after the delivery. And if the baby comes out to be positive, means RH positive, and the mother is RH negative, okay, so their blood group, they are different. Then an injection is given, NTD injection is given to the mother.
Okay.
Okay. Because so that her body is not sensitized to the blood of the baby which was inside. Okay. So there is nothing to worry about. First pregnancy escapes the consequences of RH positive or negative. But if you don't take the injection, in suppose for just after delivery, if you don't take that anti-D injection, then the second baby, if you conceive for the second time, then after 5 months, the baby might die in the uterus itself.
Okay.
Getting my point?
Got it.
So that is the only thing. Otherwise, nothing. Means there is nothing to worry about.
Also एक worry है, like I have ensured to take care of that कि too much X-ray and radiation during the pregnancies are not advisable and not good for the baby. But वहीं एक और बात आती है कि आजकल बहुत सारे अल्ट्रासाउंड्स या सोनोग्राफीज होने लग गए हैं, जो प्रोबेबली मे बी इन योर टाइम व्हेन यू वर ऑन दैट एक्सपेक्टिंग फेज या व्हेन माय मॉम वाज एक्सपेक्टिंग, इतना नहीं होता था. So that acceptance, especially मैं अपने घर का एग्जांपल लूं, my in-laws didn't have that acceptance कि इतना frequently क्यों तुम sonography ultrasound, that might affect the baby. So what exactly you can say on this part कि इतना ज्यादा जो आजकल हो रहा है ultrasounds and sonographies.
Priyanka, X-ray and ultrasound, they both are different.
Okay.
जो है रेडियो एक्टिव रेज रहती हैं and they damage the cells of our body. So even if I am not pregnant and I am frequently taking patients X-rays, or if X-rays are being done, then that can cause damage to any part of my body because they are radioactive rays.
Okay.
So if the lady is pregnant, then there is a full probability during the first 3 months when the baby is grown, means not grown exactly, but when the baby is being formed. Okay, at that time, if that lady is exposed to an X-ray, then the cells which are generated in the forming of that baby will be damaged.
Okay.
And a resultant would be a deformed baby.
Okay.
Okay. So that is the quality of the X-ray, radioactive X-ray rays, X-ray. But in ultrasound, it is only the sonic waves, sound waves.
Okay.
So they are not damaging.
Okay.
They are not damaging. And besides that, we get many information. Like if you have suppose a hole in the heart of a baby, in the fetus, then you can detect if the baby has some tumor, or if the baby has some tumor on the spinal cord, or the cleft lip or cleft palate. You can detect so many things. The target sonography, which is being done in the fifth month of the pregnancy. Correct. That is very new. And during that time, if you want, and if the disease is serious, or if if there is some great defect, then you can abort at that time. So you don't have a handicapped or a disabled child.
So to add on, like in this also, you get to know that whether the child is a special child, there is some abnormality the child is having it, वो भी चीज हमको पता चलती है. Only the specific, like you mentioned, कि cleft है, कि spinal में.
सोनोग्राफी में सिर्फ ये जो डिफेक्ट्स हैं ये पता चलते हैं. There is in certain cases there is only one chamber heart. So that baby will require repeated operations for just after delivery. So in that case, if you want, you can go for an abortion. In certain cases, the head is not developed, only the skull is not developed, the whole brain is visible, or the abdominal wall is not developed. There are so many defects which we come across, and in that case, the baby won't survive for a longer time, even if it is delivered. That will be a great torture to the mother, to the family, and of course the baby will die. So it's better to get it aborted beforehand.
Okay.
ये हो गया. Special that is done by the chromosomal test, which is done during the 12 weeks of pregnancy. That is trisomic chromosome test बोलते हैं. Double marker, triple marker tests are done. These tests are done during 12 weeks of pregnancy. That your gynecologist will suggest.
Okay.
So in many cases, and most of the cases, we are able to diagnose, especially in cases where there is a family history. One of the family members, या चाचा का बेटा या बुआ का बेटा या किसी का भी इस टाइप से they are having that disabled, then you should always go for it. Double marker, triple marker test you have to do.
In the initial conversation, when we talked about period की unhealthy lifestyles, उसमें हम medicines consume ज़्यादा कर लेते हैं. So during the pregnancy, if you get any of maybe cold cough or any headache or any stomach infection, so how much good, or even the teeth ache or tooth decay, anything we face across, so how much good it is to have those medicines? Is it harmful? Already we are taking the medicines for the baby, like folic and all. So is it good, or how we can, stop that key now? Because tooth pain is something जो आप नहीं रोक सकते. There are certain pains you can't stop it. So how to deal with that?
See, first 3 months you should take bare minimum medicines. Only folic acid should be taken. Not even B complex or not even iron, calcium. You should not take any such type of medicines also. Not even B complex, because most of the people, most of the patients, they come to us and madam, isko kuch tonic likh do, isko kuch tonic likh do. So tonics, they are should be avoided during the first 3 months of the periods. First 3 months of this pregnancy. Only folic acid and tablets for vomiting, which are specifically designed for the pregnant lady. That tablets can be taken, which are safe. Only that. You have to take some precautions. See, you can't go and have food, street food. You should not drink unhealthy water. Or if you go and attend marriages, eat salads or eat cut that fruits over there. You should try to avoid such things, because these are the things which will give you infection of the abdomen, of the stomach. So if you don't avoid, then, and if you get loose motion, then you have to take some medicines. And there are some safe medicines, but why do you want to get into that? Because मेरे को lose motion पहले मैं कराऊं and उसके बाद में फिर मैं medicines लूं. We should try to avoid. अब लोग मानते नहीं, पानी पताशे is a very big culprit. पानी पूरी, हम पानी पूरी खा सकते हैं क्या? पानी पूरी खाने में मनाही नहीं है. आप पानी पूरी खाइए, first, because there is a craving for some sour और खट्टा खाने की इच्छा होती है. आप खाओ, no issue. You make it at home ना. आप पूरी बाजार से लेके आओ, make that पानी at your place in a good drinking water. Everything is available. आप बनाओ और खाओ ना, उसको मना नहीं है. तो आप सब खाओ, but in a very मतलब decent and proper manner. मतलब why do you want to have pani puri at that street only? You can make at your place and have it. उसमें मना ही नहीं है. Don't ever have salads. जैसे अब हम क्या करते हैं, सैलेड जो हम बोलते हैं it is very good for health, and food fruits are also very good, correct? हम शादी में जाएंगे, खाना छोड़ के हम फ्रूट्स खाएंगे. आपने ये भी नहीं देखा कि whether they have been washed or not.
Correct, true, very true.
वो वहीं पे रखा रहता है. They cut in front of you and then they serve.
Correct.
So try to avoid. You have cooked food. Whatever is cooked, you can have. You can have kachori, samosa from a good place. क्योंकि it is fully boiled, means तला हुआ है. You can have that.
Correct.
And don't have fruit juice. Don't have fruit juice anywhere. I would suggest you should never have fruit juice, because that is the biggest source of infection. You have a fruit, full fruit you have.
Correct.
संतरा, मौसम्बी, whatever fruit you want, you can have. सारे fruit खाइए. आप fruit juice मत. Leave them for all the heroines and all. You don't have.
Like you said, the folic medicine, folic acid जो हम लेते हैं initial first 3 months of the pregnancy, ये हमको पहले भी शुरू करना चाहिए, like before the pregnancy, or how it is?
Actually, it should be taken 3 months prior to your conceiving the baby. It should be taken 3 months prior.
Okay.
Means for 3 months you have to take before conceiving.
Okay.
But because nobody consults at that time, so we start during the first 3 months.
Got it.
Actually, folic acid saves you from the neural tubes defects, means defects of the spinal cord. जो ट्यूब अपना स्पाइनल ट्यूब रहता है, उसके डिफेक्ट्स को प्रिवेंट करता है. तो ब्रेन वाले जो भी डिफेक्ट्स हैं, it prevents that, folic acid.
Okay.
That's why we give folic acid to. Previously it used to occur, means many cases we used to see. Now we find very rare cases.
अच्छा,
इसलिए वो supplement देते हैं.
Okay. Also, now it's like we have talked about ki pre-pregnancy या during the pregnancy what we have to take in care. अभी post pregnancy what things have to be taken care apart from the sexual life as a lactating woman, and if the lactation ends also क्या क्योंकि आजकल ये lactation is also very common that we come across. मैंने अपनी सराउंडिंग में बहुत लोग का सुना है कि मेरा तो दूध आया ही नहीं या मेरा दूध तो खत्म ही हो गया 3 months में ही. सो ये भी एक नया चीज है. जस्ट लाइक ऐसे पीसीओडी एक ट्रेंड बन गया है, वैसे ये भी एक वन ऑफ द ट्रेंड्स आई हैव सीन अक्रॉस अपने सर्कल्स में कि दूध खत्म हो गया.
अच्छा, मैं आई टेक दिस क्वेश्चन बट आई लाइक टू इन्फॉर्म समथिंग. जैसे हम लोग पेशेंट्स को बोलते हैं कि आप ड्राई फ्रूट्स खाइए, आप बादाम खाइए, है ना, ड्यूरिंग प्रेगनेंसी.
करेक्ट.
एंड आप फ्रूट्स लीजिए, आप अच्छी दाल लीजिए. तो द फर्स्ट क्वेश्चन इज, गरम तो नहीं करेगा? ये गरम तो नहीं है, ये चीजें गरम है. केला इज ठंडा, अंडा इज गरम, है ना, नॉनवेज इज बहुत गरम. तो I would like to suggest that whichever things they are rich in proteins or which are good for health, rich in iron, they are considered to be garam. जैसे ड्राई फ्रूट्स, बादाम गरम, ठीक है, पिंड खजूर, डेट्स गरम, अंडा गरम, नॉनवेज गरम, केला ठंडा. So you don't go for that. These are the fruits or these are the things you have to eat.
Correct.
These are good for your health. So you should not go for गरम और ठंडा, क्योंकि पहले के जमाने में केला नहीं खाने देते थे. केला खाओगे बच्चा जम जाएगा, बच्चे को सर्दी हो जाएगी.
करेक्ट.
बच्चा जब
I
होएगा तो
too
उसको
heard
हमेशा,
this, yeah, during my phase. कैसा सुना था मैंने भी. हाँ.
तो जबकि केला is the best fruit of all. That is easily, that is the cheapest, that is easily which can be eaten. You don't have to do
anything else. ना chopping करना है,
anything. You can eat as a whole. कुछ नहीं. तो ये चीजें आपको खाना है. मतलब what I suggest to them, मैंने कहा तेरी सास के सामने मत खा, तू चोरी छुपे खा ले, but तू खा. Because many of the people, those who are from a low socioeconomic, they can't afford apple. They don't अनार नहीं खा सकते हैं, बादाम नहीं खा सकते हैं, तो केला तो खाओ आप.
करेक्ट.
ऐसा. फिर वो बोलते नहीं, वो तो ठंडा बोलते हैं कि ठंडा है. तो ऐसा ठंडा गरम कुछ नहीं होता है. मतलब whatever is rich in आयरन, रिच इन ये अपना प्रोटीन, तो सब गर्म हो जाता है. इसलिए ऐसा नहीं सोचना.
तो इन शॉर्ट एनी whichever thing is healthy, nutritious है, उसको वैसे ही लो, consume that way in your body, in short.
करेक्ट. ओके. और हाँ, लैक्टेशन का तुम पूछ रही थी. लैक्टेशन में lactation is also hormone dependent, correct?
Correct.
And hormones are released from the brain. मतलब the signals grow from here. Okay. If you are in a stress, if you are in stress or something is bothering you, your mental status is not good. Okay. You won't get good lactation. So आपका मेंटल लेवल बिल्कुल काम, क्वाइट, अच्छे से रहो, टेंशन मत पालो, तो यू डेफिनेटली गोइंग टू हैव गुड मिल्क सिक्रीशन. ओके. You yourself have to drink at least 2 glasses of milk per day while lactating. With good amount, मतलब 10 to 12 glasses of water per day. Again there is a myth के पानी ज्यादा पियेंगे पेट फूल जाएगा, दूध पियेंगे खांसी आ जाएगी. ठीक है. तो ये सब से कुछ नहीं होता है. If you take milk, you will lactate properly. If you have a healthy food, you will have good milk. The quality also will be good. आपको दूध के आपको फीडिंग, अरे ड्यूरिंग लैक्टेशन दे फीड यू ऑन दलिया. अब नाउ सपोज इफ अ नॉर्मल लेडी इज बीइंग गिवन दलिया ट्वाइस अ डे, मॉर्निंग में भी दलिया खाओ, रात में भी दलिया खाओ, ताकि दूध अच्छा आए. बट दूध अच्छा आएगा, नो डाउट, पर हमारी हेल्थ का क्या? यदि हम ही फिट नहीं है तो दूध कैसे आएगा? यू आर मेकिंग मी स्टार्व, यू आर फोर्सफुली मेकिंग मी ईट दलिया, है ना, विच आई डोंट लाइक. हमने दलिया तो पूरे कभी नहीं खाया, और
करेक्ट
उस समय लैक्टेटिंग को दलिया खिला रहे हैं, फीका फीका दलिया, कोई टेस्ट ही नहीं है, तो कैसे खाएंगे, कैसे? तो हमको एनर्जी नहीं मिलेगी तो हमारा सिस्टम काम कैसे करेगा? नहीं करेगा।
करेक्ट करेक्ट
What I suggest is, one time you have meal for yourself, means you have complete diet, roti sabji dal chawal papad chutney achar, you have everything. अचार का मतलब ये नहीं कि इतना अचार लो, नॉर्मल अचार को अचार के तौर पे लो, but you have normally. Then have 2 glasses of milk. In the evening you have light food, खिचड़ी, टिंडे, गिलकी, लौकी की सब्जी, दलिया, you can have that. तो एक टाइम हम अपने लिए खा रहे हैं, एक टाइम हम बच्चे के लिए खा रहे हैं, so that is acceptable.
राइट
अब दोनों टाइम दलिया दलिया खिलाएंगे, फिर बोलेंगे दूध नहीं आया, तो फिर नहीं आएगा.
करेक्ट करेक्ट करेक्ट
And then you will feel weak, because if you are lactating, तो एनर्जी ड्रेन्स आउट.
करेक्ट
तो
वेरी
इनफैक्ट वहां तो उस समय तो आपको बहुत अच्छे से खाना चाहिए. You can have everything. You can have all types of fruits. Even banana you can have. You can have dates. You can have almonds. You can have everything.
गॉट इट
With plenty of water. और mental stress कम करना. In fact, it is said that when you are lactating, at that time you keep a glass of water ready for yourself. In between feeding your child, you drink water. That also increases the breast flow.
करेक्ट
Keep your mobiles away.
राइट
क्योंकि क्या होगा, आपने मोबाइल की घंटी बजी, या घर में बेल बजी, या किसी ने जोर से चिल्लाया, बच्चा डर जाता है ऐसे. और जब बच्चा डर जाता है, she or he will stop feeding. तो आपका भी सडन डाउन होगा, एंड you will, मतलब the quantity will decrease.
करेक्ट करेक्ट करेक्ट
Feeding should be done in a very calm and quiet manner. कोई शांति से भी इसको दूध पिलाओ, इनफैक्ट भगवान का नाम लेके दूध पिलाओ, खुद भी एक घूंट पानी पियो बीच बीच में. और खाना तो मैंने आपको एक्सप्लेन कर ही दिया. एंड शांत मन से पिलाओगे तो दूध आएगा, ऐसा नहीं. देयर आर सर्टेन केसेस वेयर नहीं आता है, तो फिर हम वी आर देयर टू राइट मेडिसिन लेते हैं, फिर कुछ ग्रैन्यूल्स वगैरह आते हैं जो दूध में मिला के पिलाते हैं, वो देते हैं, शतावरी एंड ऑल, तो उससे दूध आता है.
ओके we have
Okay.
a good session with you. Of course, more topics to be covered. अभी भी ऐसा लग रहा है बहुत कुछ है. We can plan some another day with another session with you. But abhi I have to put this to an end. We have quite a healthy discussion, and hope much, doctor, for being with us and talking about it. On behalf of my entire ParentSi, I would like to give a loads of thank you for giving certain very quick tips and knowledges जो हम वर्किंग, स्पेशली हम वर्किंग लेडीज के लिए बहुत जरूरी था. कुछ चीजें हमको नहीं पता थी या कुछ हमने इग्नोर कर दी थी. बट एक्चुअली आई हैव ऑल्सो लर्न, लाइक आई एम लैक्टेटिंग वुमेन राइट नाउ, तो अभी भी मैंने बहुत कुछ सीखा है जो मैं शायद अभी गलत करने जा रही थी या कर रही थी फॉर फ्यू मंथ्स. बट आई विल इंश्योर कि मैं ट्रैक में वापस आ जाऊं कि थिंग्स गो स्मूथ, बट आगे भी वुमेन्स के लिए वैसा रहे. तो थैंक यू सो मच डॉक्टर पिनाक फॉर बीइंग विद अस. And
thank you so much. Thanks for inviting me, and I also like sharing my knowledge.
And we wish that, I
enjoys.
hope I have actually captured a lot many questions what people have asked with me, especially the moms. But in case I've missed out, we'll of course connect with you in another time if
Anytime. Anytime.
So thank you so much, and namaste for being with us.
Namaste.
All right.
Okay. Bye.
Bye bye.